Welcome to another episode of the HealthCast. We're real excited to have Dr. Curtis Westersund today, dentist from Calgary, Canada, and a real specialist in the care of TMJ. We're excited to have you, Curtis. Welcome to the HealthCast.
I'm happy to be here, Phil. Happy to help out.
All right. Why don't we just start off with your background a little bit? Tell me maybe a little bit of how you became a dentist. Maybe, I don't know if it was a long-term passion or where you were at with your schooling.
That's a very easy story. I grew up on a farm, and it was me, my dad, and a hired hand, and kind of a long ways away from neighbors, and was a little bit isolated. And I decided that I didn't want to drive a tractor around and around in circles for the rest of my life. So I said I'm going to go and get a profession, and got into dentistry and graduated in 1979.
Saw that.
Now, yes, I'm old.
You've been a
I
dentist for 40 years.
started, yeah, 45 years. 45 years.
Well, that's a heck of a
This is
skill
my
set.
46th year.
Yes, sir.
You know what? It got to be kind of fun because dentistry was just, we call it when you drill, fill, and bill. That gets a little bit boring. But I had a problem. I had a problem because I grew up in a farm. I had some teeth pulled out when I was a young kid, because back in the day when your teeth were crooked, they pulled some out. That was the way you did it. And unfortunately, that left me with a whole bunch of problems. I had migraine headaches. I had migraines that were so bad that I'd be on my knees and nausea, vomiting, crawl into a closet to get away from the light. That was probably once a month. I had
Ooh.
headaches every day. And so that was not a fun thing. And I had that till for the first 20 years of my practice. And then I went to a little course, and I was listening actually to they call him a chirodontist. It was a chiropractor, but he kind of understood about the head and the neck. And so I'm sitting there going, okay, that's me that he's talking about, and started to get this treatment, or started to look into getting treatment myself. And it's one of those doctor heal thyself. So I made myself this special mouth guard, night guard, basically an orthotic. It's You and I both have glasses on. Those are orthotics for our eyes. So I made one for my mouth, and I still wear one today. And that orthotic, I put it in. I was having a migraine headache, and it was the start of a weekend. And I had gotten the orthotic in my office, but I hadn't put it in before I left her home. And the next morning I wake up from a migraine. I'm going like, I'm going to drive down my office, get this orthotic. Pounding migraine headache. The medication's not helping. I'm not feeling great. So I drive about a half hour to my office, and I get to the office. I put it in. I'm just feeling horrible. The migraine's just pounding. Go get in my car, and I'm driving home. I right actually out in front of my office, and I threw up all over myself,
Oh, my
which
God.
it was a nice, bright, sunny day. Yeah. So you're just like, oh, this didn't get any worse. Half hour drive home, get home, throw the clothes in the dishwasher, throw the clothes in the washing machine, have a shower, get back into bed. And I'm just laying there feeling sorry for myself, because I'm a guy, right? We feel sorry for ourselves, don't
For
we, Phil?
sure.
Yeah. And so I'm feeling sorry for myself. And all of a sudden I realized I didn't have a headache, and my migraine is gone. And this had never happened before. And so I'm going like, hey, maybe this stuff actually works. And so, being the curious kind of person I am, I popped out my orthotic and say, does this actually make a difference? And I had it out for about 15 seconds, and I could actually feel the migraine coming back on. And I put it back in. That was my last migraine. So I haven't had a migraine for over 25 years.
My
So
goodness.
yeah, and that kind of made me kind of passionate about it.
Yeah. Yeah.
Knew a lot of people that had that problem, and you go down a rabbit hole when you get excited about things. You're going around and around and around and around down this rabbit hole, and it was about how the body works and how everything is all connected. And in my profession, we think the TMJ is just this bone that does stuff, and we think the teeth are just things that you try and make pretty so you got a nice smile. And we didn't connect this to the rest of the body, and how this is so important for the rest of the body, because teeth are basically the way that we're able to function, the way we're able to eat, talk, stabilize our torso, and do all those wonderful things. But without the teeth there were a bit compromised, and I certainly was. And so that got me into doing this. About 25 years ago, I started working strictly just on this TMJ stuff that is looking at how the joint, how the teeth, how the head and neck, and how the rest of the body. Basically, we call it from teeth to toes
Yeah.
because it's all about alignment. I can actually give you a filling on a tooth. Come up to Calgary. Beautiful kids, beautiful, right beside Banff. Come on up to Calgary. Yeah, yeah, come on up. And we got a nice place you can stay here. Anyway, the we can put a filling on a tooth, and we can actually change if your 2 feet were pointing straight ahead. We can make a foot point outwards because
Oh,
we put a filling on a tooth that was
isn't that
too
wild?
high
Yeah.
because you're all one person.
Yeah.
And it turns out that our profession and the medical profession, they kind of cut people apart just for their own convenience. But people don't work in pieces. We work as a whole thing. And that's kind of what directed the rest of my 25 years of my career. And hopefully I get another 25 more. I don't know.
Bear with me. I'm not as fluent with dentistry terms as I am in medicine.
Yes.
So do you have, does your specialty have a name, or what you do have I mean, I'm familiar with TMJ, but
There is no specialty in TMJ. There's a specialty in oral facial pain medicine, but there's no real specialty in TMJ. So it gets dumped to a lot of different other types of dental specialties. So you have people that do surgery. They're called oral maxillofacial surgeons.
Mhm, mhm.
And sometimes, if a dentist has a TMJ patient, they'll boot them off to the oral maxillofacial surgeon, and he gets it and goes like, "Yeah, I don't know what to do. I got a scalpel. Maybe I'll cut something." Or they send to what's called a prosthodontist or to some other type of dentist that may not be able to do anything that's going to help that patient. And then there's a few of us, just general dentists, that kind of get off on helping people, and that's kind of what we do.
Yeah, yeah. I love it. Tell me about some of the maybe memorable successes and challenges that you've had in your career.
I Well, I'll tell you about this young lady. She's 16 years old. She comes in with a bunch of TMJ problems. She can't open her mouth very wide, and her dad was a patient. He says, "Will you help my daughter?" And we got her through all of our machinations. We got her so that she could open. She was feeling better. She didn't have the headaches. And I'm taking some photos of her, and she's sitting in the chair, and her head's down, and it's tipped like this, rotated this way. And I'm going, I screwed up. And what I had done, what I hadn't done is I hadn't looked at how her head and neck was part of how her teeth came together. And that kind of hit that home for me that with Christina, we had to look at everything. And so we had a type of chiropractor called an upper cervical chiropractor. They just look at the head and neck alignment. They don't crack bones, they just give massages in the right area to get people's head and necks aligned. We had her go into this upper cervical chiropractor, and she came back, and I recorrected the bite to make everything just right. And then when she came back and we finally got everything balanced out, she was straight. Her head and neck were straight, her jaw was functioning properly, her shoulders were proper, her hips were proper. Everything was working simply because I stopped thinking about her as a set of teeth floating in space, but thinking about her as a functioning human being.
Yeah, yeah. Has anyone? I was thinking, kind of going the opposite direction. Has anyone come to you, say maybe they're a dental patient, and they say, "Oh, just through conversation, oh, I'm really struggling with neck pain or something similar," and you circle back to, as opposed to say starting with oral health, have you just say a friend or conversation, neck pain, shoulder pain, something along those lines, and then it turns out they have some jaw issues? Has it gone? I'm sure it goes both directions, bi-directional.
Every single working day, Phil.
Oh,
I see patients like that every day. And sometimes I like to say I get everybody's problem patient. If they've tried to solve the issue conservatively and with something simple like you've heard of night guards and things
yeah,
like that, they try and solve things simply that way. And sometimes that works. But typically, if someone's got enough of a distortion, they simply just can't be put into alignment, into structural alignment with something just as simple as a night guard. They need a little bit more care. And I act as a quarterback for my healthcare team. So I do just dentistry. I do the dentistry. deal with the jaw joint issues. That is the limit of my license. That's the only thing I can do. I have upper cervical chiropractors that are on my team that I can refer to.
Very
I have
cool.
biomechanical therapists I can refer to. I have physicians that deal with concussions I can refer to. Even your eyes, an optometrist to look at binocular vision becomes important for a lot of these patients. And a lot of times we're also dealing with, at the same time as, say, jaw muscle pain and all these other issues, forward head posture, we're also dealing with airway. And that's actually the second rule in my office, Phil, is I only treat breathers. If you're my patient and you become a non-breather, we will dismiss you from the practice.
Fair enough.
Simply because non-breathers no show appointments, they don't pay their bills. I got a business to run.
Yeah,
They
yeah.
don't pay their bills. And
Understand.
so you're the most important thing in your life right now, Phil, is your next breath. If you don't get that next breath, you're going to you've got about a podcast for about another minute. And that's about
Signing
it.
off, folks.
The sign off will be a lot more dramatic. So these are the types of things that we're looking at. And then since I only do certain parts, I have to have other people that I trust that I can refer out to deal with. I don't do massages. I don't do head and necks, alignments. I just do teeth.
Yeah.
I'm kind of the simple one of the bunch.
Can someone someone in your community walk in to see you? Or I'm getting the impression that you have a unique set. I don't want to understate it. You have a unique set of skills, and are the dentists that people refer other when the other dentist can't figure it out, they refer to Dr. Curtis Westerson. Is that about right?
Yeah, a unique set of skills. I'm like the movie Taken. Yes, I have a unique set of skills, but it's amazing. So one of the things that I started to see once I started doing this is that my own patients were having all these issues, and I had just didn't understand it. I had messed up trying to fix people in the past, and I'm going like, oh my goodness, I should have dealt with this a different way, but I didn't know. You don't know what you don't know. So
Yeah.
we end up having patients who refer to me, patients that come off the street and all these things. And some of them are in pain. Some of them are not in pain. Some of them have worn down teeth. Some of them have, spouses that want to sharpen their elbows so that they can jab them in the middle of the night to stop them from snoring. We have all those types of people that we come in and we just are able to figure out what the overall problem is, what the patient wants to deal with, and then just offering treatment from there.
Yeah.
But it's more of an informed treatment plan for the patient. So the
Yeah.
patient's learning a little bit more about themselves.
I have some catchphrases I use in my practice, and one of them is that I think oftentimes patients look for. I call it a splinter solution, like remove the splinter, all better. But in reality, I think, and I think this is what I'm hearing from you, that I think a lot of things are multifactorial, and it sounds like that's what you're saying.
Yes.
Yeah.
Well, patients want certain things. They want to be quick, like
Yes.
just fix me like that. They want to be painless, which actually the treatment I do is painless, so that's okay. They want it free, or if not free, really cheap, so that insurance pays for it. A little bit more of an issue, and they want it to last forever. Do the one treatment, slap you on the forehead. Do the one treatment, and I never have to be treated again. And fortunately, things wear out, like a car wears out, your jeans wear out. Well, people wear out. And when people wear out, stuff starts to fall apart. Now, it sort of depends on whether you're going to be seeing that um, 17-year-old teenage girl as a patient or the 65-year-old man as the patient as to what their problems may be. But after 25 years, you kind of figure out, what people do and how they're going to break down, how they're going to fall apart.
I'm thinking in medicine, we hear, a rise in, say, diabetes and hyperlipidemia and such. Have you seen a change in common oral concerns or oral health diagnoses across your career? Are there things that maybe are becoming more problematic that people aren't as say that they're not as fluent in as say their waistline or the belt or their weight or something like that? Are you seeing that in your over time?
Okay. So Phil,
Maybe that's a silly
were you
question. Maybe
were you born in 1979?
I was born in '76.
You're born in 76. So you're 3 years old, a strapping young 3-year-old.
Sure.
They didn't have computers back then. There were no cell phones back then. There was not a lot. So everything we had was analog. And so we couldn't see inside the humans. So we kind of made up our own theories about what was happening, and we do studies to test these theories. And, yeah, a lot of times they were wrong. With the advent, and especially over the last decade, the advent of digital therapeutic devices, digital measurement of things like your bite, your or the x-rays that can wrap all the way around your head and show you what we call a CBCT of this skull, and we can even earn an MRI. All these advents of digital measurement now allow us to go and see much more about what's happening and understand what's happening, because we get to see how people how maybe that jaw joint that we thought was just fine was actually almost totally eroded away. And the one we thought was a problem was actually really healthy and it didn't have a problem. So we're looking at that and how that works. It becomes this eye opener for dentists, and our profession needs to get better at this. I mean, right now we start to take digital impressions. Hey, that's cool. You don't have the goopy stuff in your mouth. That's really cool. But it's so much more past that. And it allows us to see people in more of an actual light of how they're actually functioning. So dentistry nowadays is way more exciting than it was back in my day. And yeah, I rarely use a hammer to take a tooth out. Rarely, Phil.
That's good news. That's
Yeah.
yeah, yeah. I feel like I'm just jumping around here. I feel like people underestimate the impact of OSA, of obstructive sleep apnea. Can you talk to me a little bit about how you approach things and maybe your thought? I feel like it's just they think they're snoring and it's annoying, but in terms of fatigue or other impacts and blood pressure, I feel like it's an underappreciated diagnosis. What are your thoughts?
Totally agree with you, Phil. Totally agree with you, because it's underdiagnosed not only in the dental field, but also in the medical field. And we see a lot of, I had a patient in just the other day where they were talking about her allergies and looking at whether or not they were going to do some lung treatments, etc. Basically, nobody had done a sleep test on her. And when we took a cone beam CAT scan, we see that her airway was constricted. Her airway was probably half the diameter of that pin.
Oh my goodness.
I have a horrible airway. My airway is 57.9 square millimeters at its narrowest. That's that's smaller than a Slurpee straw, smaller than a straw. I have a horrible airway, and this person had a even worse airway.
Sure.
But they've been doing all these treatments, and she was on all these medications that would have made her less unhealthy if we had simply dealt with her nighttime and daytime breathing. So it's extremely high blood pressure, extra weight gain. It's hard to lose weight when you have um, restricted upper airway syndrome, or UARS, because you're producing hormones that are kind of in that fright and flight. You're not getting the deep sleep. You're not getting rejuvenating sleep, all because you have a small airway. As I said, the most important thing in your life is your next breath, and that's day and night. We get a lot of patients that are clenching. We clench at night. So, okay, why? Well, it turns out there can be some rhythmic clenching activities at night, but it turns out that when your blood oxygen level drops and your CO2 builds up, especially happens in REM sleep. Have you ever heard of REM sleep before?
Sure.
Your eyeballs are moving, your diaphragm's moving, your chest up and down to pump your lungs, but all the other muscles in your body are flaccid. They all collapse, and your mouth collapses, and you're snoring maybe, or you're just trying to get a breath. And the body sees a buildup of CO2. And there's little CO2 sensors that say, okay, we're going to now produce a stress hormone called cortisol. And we're going to have what's called a micro arousal. We're going to go from a deep REM sleep, and we're going to go into a lighter sleep mode where there's muscle activity. And now all of a sudden we have more than just the eyes and the diaphragm, or all of our muscles are able to be active. And so what we do is we want to open up the back of that airway, your upper airway, a little bit. So we clench our teeth together. And that opens up that oral pharynx and allows you to breathe more easily. And then you eventually take a few breaths, and then you fall into a deep sleep again, and the same thing repeats. And so we get people having this rhythmic clenching at night, probably just to allow for these micro arousals that's going to affect the quality of your sleep. It's going to affect your brain health and all these other issues. And there's studies now stating that airway issues may lead to things like Alzheimer's and dementia, and how that could be all tied in. It's lots of research needs to be done all of this, but there is connections between all of this as well.
Yeah. Mixing things up here. As I was reading over some of your information, have you heard of the book Breath by James Nestor?
Great book, great book. I
I,
think I have it here.
I love that.
So-
That's great that you're familiar with it. I really the whole nasal breathing, the importance of nasal breathing was that introduced me to that, and what else do they call with breathing? You know, some in our world, oftentimes with the stress that a lot of us are under, people are not taking full breaths, right? So it's a shallower breathing, and
Shallower breathing, yeah,
I-
and they're using their intercostal muscles or their upper chest muscles to inflate so they can get that air in. So, I mean, nasal breathing, nitric oxide, which decreases body inflammation in blood vessels. And I mean, that's coming from nasal breathing. That's not coming from mouth breathing. But here's the rub. I take this cone beam CAT scan that lets me look at all these patients. So I've had a cone beam CAT scan for over 20 years now, and I've seen a lot of noses. And inside those noses, there are things called turbinates, little fleshy parts inside the nose. And then there's a septum, which is if you have a straight nose that just goes straight up and down. But we see people that have a very bent septum, or these fleshy parts, turbinates, can respond to the patient's sensitivity to the environment. And so the environment, whether it was the carpet in their house or the cat sleeps on their face or they're allergic to zucchini, whatever the problem is, these turbinates swell up.
yeah,
And so the amount of air that you can get in to the back of your throat is limited. You have to breathe more in or breathe with more effort. So typically, if you can't get air in through your nose, you open up your emergency air hole, which
right,
is your mouth,
right,
and then you end up being mouth breathing, and that changes at a young age, changes the shape of your jaws and changes the the position of where the teeth mesh together, and eventually changes the jaw joint, and it's all coming around full circle.
yeah. I I think we said this before we started recording. Just I was really struck by one of the things that you emphasize is and I wrote it down here: mouth, body, life connection. And I think that's what we're saying here
Yeah.
with breathing. Just how interconnected all these pieces are. I just think it's fascinating. And I think we were saying I'm not sure if we started our recording at this point, but looking at the person as a whole. And I think that's a great way to approach care.
Every patient comes in as a complete human. And I have to think past what my profession does, but how that what my profession does affects that patient. And all that becomes really crucial to and even to longevity. I mean, we talk about, I want to live a long time. So not being overweight, that's great. Exercising, that's great, but breathing. And how much inflammation do you have in your body because you're not breathing? So something as simple as snoring,
Yeah.
you mentioned about snoring, and the snoring may not actually kill you, but it's a big sign, it's a big flashing red light that there's a restriction of that upper airway, and you may be trying to get air in during the night. Now, I can't tell just by looking at you, but I might direct you to have a sleep test, and a sleep test gets read by a sleep physician, and the sleep physician can tell me, if you have sleep apnea or sleep hypopnea or upper airway issues, all these things that are going to be crucial for me to make a treatment plan that's going to be effective.
Yeah. Curtis, are you involved with, I'm just so impressed with the things that you're saying and your approach. Do you teach dental students? Are you involved in a university in Calgary or?
I teach other dentists. Actually, last weekend and this coming weekend, I have dentists that come into my office, and we have a treatment or a teaching program. I may be starting to teach at a university that isn't quite solidified yet, but there's a chance I'm going to be teaching a university down in the U.S.
Yeah.
I also teaching some upper cervical chiropractors, and I go to upper cervical chiropractic conventions to kind of enlighten them because they're in the same boat. They deal with basically the base of the skull down. Well, because they don't deal with this upper part, they don't see things that are affecting how their misalignment might be thrown off because someone's bites off or some crown was made too high or too low, and how that becomes effective in altering the head and neck posture.
Sure.
So yeah, teaching, I obviously I'm an old guy and my son's a dentist. I'm teaching him, but I really want my experiences and my research and protocols to be able to carry on. So there are more TMD patients, especially just in Calgary, than I can teach or I can treat. I'm sorry,
Sure.
I can treat. There's more than I can treat. We have an organization called the International College of Craniomandibular Orthopedics.
Hmm.
A word soup. They call it ICMO, International College of Craniomandibular Orthopedics. ICMO. So we've got this ICMO, and it's a bunch of like-minded dentists. I'm the past president of ICMO. The last conference was in September for North America, but it's international. So they're around the world. There's Japan, there's Italy, there's Russia, US, Argentina, a whole bunch of other ones I haven't mentioned, but they're all part and parcel of this group that allows us to pass the education along to other dentists that want to learn more about it.
Yeah. Cool.
It's just why I want everyone to think it's simple to learn. You just have to learn the protocols. You don't have to reinvent the wheel. It's not mystical or magical. It's just measurement. And I'm a farm boy. Boys out there, but I'm a farm boy. If I could learn it, just about darn well anybody can learn this. So it's not a big deal.
I'm
You
going to
just need
take
a
that to
few
heart.
tips.
I'm going to take that to heart when I find something challenging just to keep applying myself. I appreciate your humility.
Thank you.
Your business is it the Dental Life?
Yeah, dental life doc.
Dentallife.com. How long so you've been a dentist 45 plus years, 46 years. Have you always had your own practice?
Yeah, actually, I've always had my own practice.
Very cool.
Actually, I bought the practice I started in after 10 months. So
Okay.
basically, yeah.
Yeah. There you go. Pretty much. And I was just going to ask, how does the future look for your business and for you?
And we got, you know what, there's always going to be problems that are happening with any profession. There's a lot of changes. Like I said, back in the day, we kind of go like, you look good. But now we're measuring down to 4 microns and we're actually 4/1000th of a millimeter to make things really precise. The big thing in my business and in the medical field and chiropractors and veterinarians is corporations and chasing the profitability of a profession versus maybe chasing the outcomes that you're getting with your patients. 99 times out of 100, the outcomes are really good. It's the one time out of 100 that maybe they kind of fall short on. And I might be being generous there. But anyway, that point is that I can guarantee that knowing more about something is going to make somebody a better clinician and make their dental career go more smoothly.
Yeah. You're pretty involved in social media. How has that impacted your business?
So everybody's looking, oh yeah, again, social media and stuff like that.
Hey, I saw a few of
You
them. They
know,
look great. You have a good time.
yeah. We, old dentists, Facebook and all the young people are going, my God, my grandmother's on Facebook. It's so old. But I had actually one of my patients, she has a firm called Reframe Social Media, and I was talking to her about one day about doing some WhatsApp or what? Look at this. Sorry, doing some scrub that.
Yeah.
Talking about doing TikTok,
Yes, sir.
and she said, "Oh yeah, she's. I've known her since she was 3 years old, and she's 30 now. So yeah, you should be doing some TikTok." So we started doing TikTok, and it's fun. It's trying to find out how to have a message but still be fun while you're doing it is kind of a challenge. I'm hoping I'm hitting a few, um, laugh buttons on when people are watching my TikTok.
Well, that's I've enjoyed them. So I think that sounds great. And I think you should keep at it.
I think I will. I think I will.
There you go. Well, Curtis, thank you so much for joining us on the HealthCast. It was a pleasure speaking with you. I was really impressed with your work and your story of your own oral journey and how that's helped some of the things you learned, how it's benefited your patients. So thank you so much for sharing. Thank you so much, Curtis. And
Not a problem.
where people could learn more about your message and what you do for work, where's the best place for people to learn more about you?
They can see my websites at dentallife.com, 1L dentallife.com. And I'm on WhatsApp under Dr. Curtis Westerson. So
Okay.
come and check that out. Follow me on WhatsApp and
All
we'll
right.
have fun.
All right. Thanks, Curtis. Appreciate
Thanks.
you
Thanks,
coming on. Stay tuned for our next episode. Thanks so much.